Sir, why you have prescribed Calcarea Carb after Rhus Tox, even though patient was better after giving Rhus Tox in lumbar sprain?
Basically, when you think about the Rhus Tox is a very acute remedy. Very acute. If you open the Borix Matremedica and remedy relationship, you will find Rhus Tox has very short action, 1 to 7 days only. Yes, definitely Rhus Tox is a very important remedy for sprain and strain. Very important. But acute phase of the sprain and strain is covered under the Rhus Tox. It is not the chronic sprain. If it is recurrent, we have to stop that. This, even after completing this cure, one should not have a recurrence over there. The sprain happens because there is a weakness, muscle fibers or ligaments becomes weak, and that's why they strained and they sprained. To get a strength back, Calcarea Carb plays a very vital role. Calcarea Carb is a very deep acting anti-psoriatic remedy. Rhus Tox, Calcarea Carb is a complementary to Rhus Tox. And if you open the Borix Matremedica, you will understand that in the back region. Read the back part of from the Borix Matremedica, you will get the answer of it. We'll just open that. I will show you what is the importance of it. So it is on page number 147. Calcarea Carb back. What he has said: pen as if sprained, can scarcely rise. Very difficulty to rise up from overlifting. So this is with patient always comes, and they never gets cured even after giving a painkiller, anti-inflammatory. The sprain remains over there and they cannot rise from the bed. This has started right from the lifting the weight. Rhus Tox is an acute remedy. Rhus Tox has same future, but Rhus Tox cover the acute state. Calcarea, if it persists for longer time of duration. Pain between shoulder blades, impending breathing. See, this is again one important thing. Pain between the shoulder blades. The shoulder blades where there is a pain. Again, Rhus Tox is very important remedy. Semicifuga is very important remedy, but that covers only the acute states. Chronic states never get covered under the Rhus Tox and semicifuga. You have to give the Calcarea Carb in order to get permanent result over there. Rheumatism in lumbar region and weakness in the small of back. Many people never understand where is small of back. This is very important thing. One must know it. It is a belt area. That is called as small of back, where there is a sacroiliac lumbosacral joint happens to be there. That area where one wears the belt, that is a small of back. And this pain, because of chronic sprains, Calcarea is very important remedy. Curvature of dorsal vertebrae. What it means? When one sits straight, there are 4 curves to your spine. If you look towards the spinal canal structure, the first cervical vertebrae, they are convex posteriorly. Then in between, they again becomes concave, and then thoracis to the lumbar, it is concave, convex posteriorly, and again at the lower level, lumbosacral level, it goes again into concave posteriorly. But generally people sits in the ease posture. This is the posture with which patient sits. So patient never sits straight. It sits like this. And once he sits like this, because of it, there is a chronic postural backache develops. That is generally a thoracolumbar backache. And that thoracolumbar backache, because of wrong postures, if it persists, and which develops a curvature to the spine, this is what is the meaning of it. Calcarea covers that. So Calcarea is a wonderful remedy for that purpose. And last point, which is mentioned over there, is the nape of neck steep and rigid. So neck muscles, if you open the Rhus Tox, again you will have the same features, stiffness of the neck muscles. Calcarea Carb covers the chronic stiffness of the neck muscles. So neck muscles, they are stiff and rigid. And lastly, the renal colic, which is mentioned. And Calcarea Carb, lycopodium sulfur, all are renal colic remedies which happens to be there. But this is one more one should not forget. So this is the reason why I have given the Calcarea after Rhus Tox, even though the patient has cured, so that you can prevent the recurrence. Okay, it take cares about the miasm, background miasm.
Thank you, sir.